I'm Dr. Saman Hewamana. I'm a specialist in blood disorders or blood cancers. If I talk to you about cancer, cancer is a genetic disorder. All cancers arise because of a change in the genetic material. It could be a mutation or a small change in the gene, or could be a translocation, what we call, that is due to a break or a joining of an adjoining chromosome. When it comes to cancers, the control in the cell growth and death is lost. We have genes controlling how the cells are growing and also how the cells are dying. In a cancer, either there is an increase in the cell growth, or sometimes it could be a reduction in the cell death, causing accumulation of cells. Also, cancer has a unique ability. It can invade surrounding tissues. That is one of the main differences between a benign and a malignant tumor. When it is a malignant tumor or a cancerous growth, it can invade into adjacent tissues. And in addition, it can also go into distant parts. For instance, a cancer can spread to a faraway organ. You know, breast cancers can go into bone or can go into brain. Similarly, other cancers also can spread to different parts of the body. When it comes to naming of cancers, mostly we name cancers according to the anatomical location. For instance, if somebody get a cancer in the lung, it is called a lung cancer. A cancer in the brain is called a brain cancer. Now we recognize this is not always true. For example, a lymphoma, which is a part of a blood cancer, can come in lungs. So every tumor or every cancer come in the lung is not a lung cancer. Also, lymphomas can come in the brain. So it is not a brain cancer as you popularly believe. It could be a lymphoma or a type of a blood cancer. More advanced way of naming cancers is depending on their genetic mutation or the genetic change. Now, for instance, there are cancers coming in the stomach and also cancers coming in the blood which can have same genetic mutation. We have increasingly recognized, irrespective of the anatomical location, some cancers can have similar genetic mutations which cause those cells susceptible to drugs which inhibit those mutations or products produced by those mutations. So the old way of classifying cancer is on the anatomical distribution or from where it arises. As I explained, it is not always true, particularly when it comes to blood cancers. It can come from any part of the body. Blood cancers come in the brain, in the breast, or in the liver, not only in the blood. More recently, or more advanced way of classifying cancers depend on their genetic blueprint, not on the anatomical location. That has a big advantage because there are drugs now which can inhibit those genetic mutations producing proteins, which can cause cure or prolongation of life of cancer patients.